being able to leverage some of the infrastructure you're building for Medicaid obviously can be used for not just Medicaid. So I think that's been a real opportunity. And I know that the plan and some of that work will be rebid next year. So I think those are some strong sentiments as provider groups and CINs. We're voicing strong support that we really want to have providers really with a strong voice at the table, able to do this work and have the infrastructure, though, needed and support to do this as a partner with the payers and the state.
Welcome to the Move to Value podcast, powered by Chess Health Solutions. In this episode, we continue our conversation with Advocate Health's Jennifer Houlihan and Jennifer Gasperini, taking a deep dive into Medicaid transformation in North Carolina, a state leading the way in innovation and provider engagement. They also chime in on infrastructure, data strategy, regulatory shifts, while we explore how health systems are adapting and where opportunities lie in a time of rapid change. Jennifer Houlihan, Jennifer Gasperini, thanks for sticking around so that we could continue this conversation. I have a couple of more questions in various topics, but one of the things I'd like to talk about is Medicaid. And let's zoom in on North Carolina, which is where our organization is centrally located. How is Medicaid transformation progressing, and what changes do you anticipate over the next 5 years?
I would say North Carolina has been very innovative and progressing in this space. With their 1115 waiver that was approved under Trump 1's first administration, it had many kind of innovations, including healthy opportunities, the advanced medical home, Tier 3, which was really focused on provider engagement. So I think from my lens, Medicaid has been very progressive in ensuring it's not just been about, transferring kind of to the PHPs or the health plans, if you will, but ensuring that there was a strong provider voice and engagement through healthy opportunities, advanced medical home. So I think we've seen a lot of progress there. I think they've also tried to be, the state department has also tried to be very innovative, although now canceled, really wanted to create strong alignment with models like Making Care Primary, and also looking at sort of the MSSP chassis for some thoughtfulness. And what has been nice about that is sort of taking in some of the things we've just talked about in terms of alignment around quality measures, reducing some of that administrative burden, really taking a look at a more holistic sort of Medicare, Medicaid, or really creating a chassis for all of value. And that's what we want. And of course, North Carolina has large health systems, but it has a lot of small independent providers. So I think they've also really tried to look at an approach that it is more broad and takes into consideration the needs of practices. And so everything from quality reporting and the burden there. So I think we've made a lot of progress in the state of North Carolina. And really, I think when it comes to Medicaid innovation, they're probably in the top 3 to 5 states that are held out as examples of some of the innovation that they've done, especially because it's been very focused on moving, to value, a strong emphasis on quality, of course, first, but then wanting to think about how creating that basis for a future where it's more of an ACO or value-based construct.
Well, that's great. And so just you touched on this a bit, but what are the biggest challenges or opportunities facing Medicaid providers in North Carolina today?
Well, I think much like in our last session where we talked about administrative burdens with quality reporting, I think that is still one of the challenges that we continue to see because, of course, we're part of a large health system, but a lot of the provider groups, whether they're with the CIN or other group, are participating in other contracts. So this idea that we have multiple different quality sets and reporting requirements. I think in North Carolina Medicaid, looking at all the PHPs and we've got standard plans and we've got the tailored plans for behavioral health and some new children's health plans coming online. There's quite a few plans even in the Medicaid space. So again, looking at all the requirements and trying to comply with all of those. And some of the core pieces too are data sharing, getting attribution, making sure that's correct, because that's so important, to having strong quality performance, ensuring that those denominators are correct. So I think all of those have been creating challenges. From an opportunity side, I think there has been one really good thing about the 1115 waiver in North Carolina is it really put a lot of strong investment in for providers, again, for that advanced medical home portion. And I think what that's done for providers is have some infrastructure support to be able to invest and do this work. And I think it's not a small number in terms of some of those PMP payments. So I think that has been an opportunity, and being able to leverage some of the infrastructure you're building for Medicaid obviously can be used for not just Medicaid. So I think that's been a real opportunity. And I know that, the plan and some of that work will be rebid next year. So I think those are some strong sentiments as provider groups and CINs were voicing strong support that we really want to have providers really with a strong voice at the table, able to do this work and have the infrastructure, though, needed and support to do this as a partner with the payers and the state versus just as a kind of a downstream recipient, et cetera.
Yeah, I'll say after a big 10-year break from North Carolina state policy work, I was really struck returning to this work at how much of a voice providers have and the great opportunities to shape and influence the policies. So I think that's a really big opportunity for providers in North Carolina.
That's outstanding. Let's move over and talk about health system strategy. Advocate plays a key role in this space, and what strategies are being implemented to adapt to the evolving regulatory and policy environment and changes that may come with a returning administration, but with new faces?
That's a great question. I think the advice that I've been giving a lot is to be nimble, to be ready to expect the unexpected. And as Jennifer mentioned, what we might think is true today may not be tomorrow. And so we just really needing to be adaptable and ready to pivot quickly, I think, to the winds of the new administration priorities that we'll see probably evolve over the next 4 years.
I think that just to add on to that there has been sort of, looking at some of the potential policy changes that may happen and may not, to Jennifer's point. So I think there has been a lot of modeling and what if scenario planning, just to look at if we see changes that may happen in the Medicaid space or site neutral or shifts that may or may not happen in some of the fee schedule piece on the provider side. So I think there's so many what if scenarios, and then looking at what our overall strategic plan is and what our leadership has added as priorities is trying to align those. So I think flexibility and frankly, from my vantage point, kind of still in a wait and see approach, because it's nothing is, I think we'll see maybe in the first budget and then have to kind of see how that trickles down.
Some solid advice. Moving over to data, has CMS become more data focused in its expectations? And what's changing in how they use data to guide and evaluate value-based care?
So I think, as Jennifer just mentioned, we're still learning that information, but I have heard a couple of things. One, Kim Brandt who spoke at the NACO's conference did talk about how data would be a priority for Dr. Oz, the new CMS administrator. And we know also that Chris Klomp, who's the director of Medicare, has a big focus and background in in technology, health IT, and focus on data. So I think this is going to be an area of focus, and excited to learn more, because improving interoperability and data sharing really helps ACOs and really the movement to value.
Well, looking forward, how do you see data infrastructure evolving to support population health management?
Well, I think it has been evolving, but a couple things, just as Jennifer said, that is, we are hearing, and given some of the backgrounds of the new CMS and leadership, is a much more tech-enabled integration focus. So I think, some of the important pieces that we know make a huge difference are real-time data. So how we're leveraging real-time clinical decision-making and a lot using that for care coordination. So I think that will continue. And the idea, again, if we're trying to reduce burden and create some alignment, we need better sort of data exchange across providers, payers, other settings. So hopefully, I think we'll see that continue to evolve. And then, of course, AI, there's a lot of potential there. I think we're still some guardrails and how that will be used, but would be remiss without mentioning how, that's certainly entering into the equation now, and probably even more so as we think about how we ingest all of the data from multiple points and create these actionable insights that our various members of the care team. And I think one of the other things that we've heard can use is that, how do we give data to patients to allow them to use information? So I think there's a lot of, thought around that, but advanced analytics, AI, how it's patient-centered and help in patient decision-making, I think will all be themes that will continue to evolve. And I think we'll see a lot of advancement there. I think that is an area, again, as Jennifer mentioned, of both strong technical background and interest of this new administration, and thinking about that in the context of improving efficiency. And so I think this is going to be a big area of focus, and it'll be interesting to see how that plays out.
What initiatives are you leaning into to incentivize patient engagement, and how are you measuring any effectiveness?
I feel like this is still a very evolving area. There's a lot of platforms, mobile apps, of course, telehealth, remote monitoring. Those are pieces that we've used on patient engagement. I think we still need to see some better integration of those platforms. But I think that this is an area, we've had use of AI chatbots and, working with partners that engage our patients in different ways. I've also seen, obviously, incentive models where you're incentivizing and providing some sort of benefit to patients if they do certain milestones or behaviors. So I think the tech enablement has been a big piece that we've probably tapped into most. And then we've also partnered, with community-based organizations on some of the other patient engagement pieces and supporting them in that ways. But I think there are still a lot of opportunity. I think one of the areas we saw in that rule too was an RFI around thinking differently about new measures of well-being for patients. So I think that what really matters to patients and patient-reported outcome is still an area that we'll see more growth in. I don't know, Jennifer, anything to add to that?
No, I echo all of your comments, and I think it's a big area of opportunity. A lot of people are trying to really work on this, and interested to see how this evolves.
That's great. So we have an immense level of expertise in this interview right now. If you had a magic wand to improve one thing about how we track and report on outcomes, what would that be?
That's a good question. One thing that comes to mind for me is improving interoperability. I know there's just a lot of workarounds and Band-Aid solutions to overcome the lack of interoperability. And I think if we had true interoperability, it would make a lot of this tracking and outcomes focused analysis a lot easier.
I agree with that. I think also a lot of the conversations I'm in is the kind of the need for better sort of better behavioral economic modeling. We have a lot of interventions that we deploy in pop health, but we don't always have the sophisticated evaluation to know which one worked, or the sophistication to know which patient segment it worked best for. So I just think we continually need to have this ability to showcase the wonderful outcomes that we're achieving in this space and tying that to economic and financial. And of course, we show the savings we generate, but I think there's a lot of benefits that we're providing. But as we all know, we've got to show both that quality and cost or savings piece, and just needing to ensure we have strong evaluation models that can demonstrate that.
Well, if you look into your crystal ball, can you tell us what you see happening in healthcare at the federal and state level over the next 5, 10, and 15 years?
Well, my instincts are telling me that it's hard to tell you what will happen in the next 5 minutes these days. I think the landscape is changing at a pace we have not seen before. And I have developed an eye twitch because things have moved at such a fast pace, and it is really overwhelming. So I do think the next 4 years, though, will be very telling, and it's going to be a wild ride.
Yeah, could not agree more with that sentiment. I mean, I think I really want to see the strategic refresh come out for CMMI, especially when we kind of review the past, 3-4 plus administrations. You saw this clear progression of goals of shifting Medicare beneficiaries into value with 100%. So I would still say and believe that we're still in this journey of transitioning from volume to value, and would love to see that become more of the mainstay, or we've achieved a tipping point. And I think it'll be a really interesting, as Jennifer said, next 1, 2, 3, 4 years to understand and how Medicare Advantage evolves, where we see CMMI take downside risk. And so that's kind of my hope, is that we continue to see it evolve, but in a sustainable, and that we can really see sustainment in our savings, and not sort of have this year after year where we have to sort of beat ourselves in this game, but also see real momentum across all other areas, other segments. And obviously Medicare is a lead, but we're building this work and this chassis for all patients, all populations, and want to see this deployed as widely as possible.
Well, thank you both for your time today, and it has been a real pleasure. Jennifer Houlihan, Jennifer Gasperini, thank you for joining us today on the Move to Value podcast.
Thank you for having us.
This has been the Move to Value podcast, powered by Chess Health Solutions. We hope you enjoyed the conversation. To explore this episode further, or check out past episodes and resources, head over to movetovaluepodcast.com. While you're there, you can sign up for email updates so you never miss an episode. If you're enjoying the podcast, be sure to subscribe on your favorite platform, and consider sharing it with your network and leaving us a rating or review. Thanks for listening.